Can you record now?
Good to go.
Thank you. Okay, so just going over a few housekeeping. This is the second session of our behavioral health echo for PPCL. And if you haven't already, please enter your name in the chat for attendance. Some IT reminders: if you don't have sound like earlier, just make sure you're unmuted if you have something to say. Try to minimize your background noise if possible. If you, during the presentation, between the case presentation and the didactic, if you could mute yourself, that would be helpful. And we will have a time for question and answers for both the didactic and the case presentation. If you have a question, you can always put it in the chat. We will be monitoring the chat box during the presentations. If you're having IT issues, please just put that in the chat and we can help you during the presentation. It does help if your video is on, that way we could see everyone's face and we can get to know each other and make it more of a shared experience and a community learning event. So if you don't mind, if you could turn on your camera during the presentation and during this echo, that would be helpful. I understand, of course, there may be times you may need to turn it off, but if possible, that would be helpful for us. So our agenda today is what you see on the screen. We're going to do our best to follow the time schedule. After I complete these announcements, Dr. Olivier is our facilitator. She will introduce us to everyone and do the introductions, I'm sorry, and then pass on to Brandy Dillon, who's going to do our case presentation today. Once she presents the case that she has for us, we're going to open the floor for clarifying questions, first from the participants and then the hub team. Once the questions have been answered, we'll transition to providing recommendations to Brandy. And we'll start with the participants again, and then we'll hear any additional recommendations from the hub team. And then we will briefly summarize the recommendations, and then we'll move to the didactic presentation from Dr. Olivier. Brandy, you will receive a written summary of the recommendations after the session, so you don't have to worry about taking notes if you're engaged in the conversation. After the presentation from Dr. Olivier, we'll wrap up with announcements and close the session for today. So this time, Dr. Olivier is going to lead us through introductions.
All right, good morning, everyone. And it's good to see some returning faces and maybe one or two new ones. I'm Dr. Olivier. I'm a board certified child and adolescent psychiatrist here in Lafayette, Louisiana. I am in private practice now, but I worked for several years for LSU Medical School in New Orleans. And now I'm home, so it's great to be home. It's great to be part of this project. So I'm going to call you out and just briefly introduce yourself and where you're beaming in from today, and what clinic that you work at. So Jody, you kind of introduced yourself already, but if you want to tell us where you're beaming from.
I'm Region 4 in Lafayette, but the PPCL program covers statewide. I'm a social worker and I'm the project manager for the provider-to-provider consultation line.
Lena.
Good morning, everybody. My name is Lena Reguette. I'm an LCSW. I work alongside Jody, Paulette, and Sienna on the provider-to-provider consultation line, and I am located here in Region 4, but as Jody said, our program is offered statewide.
All right, Paulette.
Good morning, everybody. I'm Paulette Carter. I am beaming in from New Orleans, so it's nice and sunny and a beautiful day here. But I'm program manager for the Bureau of Family Health and work with the PPCL program.
Brandy.
Hello, good afternoon, everyone. My name is Brandy Dillon, licensed master social worker, soon to be LCSW, hopefully. And I am with Our Lady of Lourdes Student-Based Health Center, and we are housed on Northside High School campus in Lafayette.
Sienna.
Good morning, everyone. I'm the resource specialist on the PPCL team, and I'm beaming in from Opelousas, and our weather is also nice here today.
Ooh, I'm from Opelousas, Sienna.
I know we're gonna have to catch up with that.
And Margaret Smith.
My name is Margaret. I am an LCSW. I am coming to you all from Lafayette. I am the behavioral health instructor for LSU's Family Medicine Residency Program here at UHC in Lafayette. So we treat pregnant patients all the way to geriatric population here. So thank you all for having me.
Awesome, welcome. Also on this call earlier, and I guess she got disconnected, is Lisa Spence. She is a mental health nurse practitioner working out in New Orleans. And so if she comes back on, I'll have her introduce herself and then do the didactic portion, because we're going to talk about screening for anxiety disorders in teens and children. And so you have a high-risk teen, you're in a primary care setting, you want to screen for anxiety disorders. Let's talk about who you would actually screen and what you would use to screen with. So the objectives for this are threefold. I'm going to teach you about current recommendations for screening for anxiety disorders in youth. I'm going to help you understand how to use and score the SCARED assessment, which is the screening tool I recommend. And to briefly review the types of treatment for anxiety disorders in youth. Now, this could be a whole lecture on just treatment, so it's going to be very brief treatment recommendations and I'm going to throw out some practical recommendations at the end as well. So why is this topic important? The most prevalent mental health disorder in kids and teens is anxiety disorders. I know we get caught up in depression and ADHD a lot of times, but actual anxiety disorders are the most prevalent. So they kind of go under the radar because they're kind of difficult to distinguish from normal developmental fears and phobias versus like an actual disorder. So they tend to fly under the radar and they tend to be kind of difficult to screen for. The next slide is from the CDC, and these are facts about mental disorders in US children. Anxiety disorders are highly prevalent. They're the most prevalent, actually. I know it says 9.4%, but when you look at all age groups, it's the highest, up to 20%, up to 30% in teens have an anxiety disorder, which is pretty high. Another thing to remember is a lot of these disorders co-occur. So like in the case, you have ADHD and anxiety. That's very, very common. Anxiety and depression almost have a comorbidity of 73.8%. So the two go hand in hand oftentimes, which can pose a diagnostic dilemma. You know, is it ADHD? Is it anxiety? Is it depression? So it can be difficult. And then anxiety can also present as a behavior problem too. So it can look like defiance. Sometimes it can look like anger a lot of times, but a lot of times there's underlying anxiety. The other thing to note too is that depression and anxiety are on the rise. These are pre-pandemic statistics. The CDC always lags about 2 years behind. So in the next year, we'll be getting the post-pandemic and during pandemic statistics. So just know it's going to be on the rise, and we're going to get some pretty astounding anxiety statistics, I would imagine, especially when it comes to social anxiety. So for those of you in a primary care setting, what current screening tools are you using for anxiety?
At LSU Family Medicine, they usually use the GAD-7.
Okay, so there you go. It's very specific for generalized anxiety disorder. Any other one? Because we don't typically, in a primary care setting, screen for anxiety. We do screen a lot for depression. We often use the PHQ-9, but oftentimes we kind of don't screen for anxiety.
Kids, we do use the SCARED.
Oh, you do? All right, see? But you're with LSU.
Not yeah,
Huh?
same. So I'm at FQHC.
Awesome. Good. Has anyone else used the SCARED before?
Yeah. So, my training comes via Tulane and Dr. Gleason. So one of the recommended screeners for anxiety in children has been the SCARED. And so that's what I've worked with pediatricians who have kiddos that have concerns about anxiety, utilizing the SCARED.
Awesome. We had used it in my fellowship program at Children's Hospital. We would use the SCARED on the psychiatric inpatient unit. So anyway, let's see, we can go on. So I put this slide in here. What do anxiety disorders look like in kids and teens? It can pretty much look like a bunch of stuff. It can look like anger. One thing that's consistent that you'll see in with multiple descriptors, multiple presentation is a disturbance in sleep. That's like consistent across the board, but bouts of crying, trouble concentrating, getting angry, being overly negative and expressing negative thoughts all the time, being overly pessimistic, headaches and stomach aches, lots of physical complaints are often a sign of anxiety, restlessness and fidgeting. So you can see how a lot of these symptoms tend to overlap with ADHD and inattention. I also put the next slide into, this was another, along the similar lines, what do they look like in teens? I like some of the descriptors in here, like number 4, chandeliering, is that explosive angry outburst that their anger flies through the roof into the chandelier is the way it's described. So, and then also another thing I liked about this one is over planning. So perfectionism kind of goes under the radar. So oftentimes I get referrals, and often it's girls, about being overly perfectionistic and overly scheduling, overly planning things. That's often a sign of anxiety as well. So there's 7 types of anxiety disorders in our current DSM-5. There's generalized anxiety, social anxiety, which is also called social phobia. It's the same thing. Panic disorder, agoraphobia, which agoraphobia, it's the specific fear of particular places and situations that may cause you to panic. So it's almost like a fear of having anxiety in a specific situation, but it's a specific phobia. Other specific phobias, claustrophobia, fear of the dark, fear of spiders, fear of needles, fear of doctors. Number 6, separation anxiety disorder. And then number 7, selective mutism. On the next slide, I put a little graphic that kind of describes each anxiety disorder, like separation anxiety disorder. What is that? It explains what it is, and it shows you common behaviors like sleeping with the caregiver, following them around, avoiding school or other activities, generalized anxiety. It can look like seeking constant reassurance, difficulty focusing during the worries, difficulty sleeping, irritability, and restlessness. So I kind of like that graphic. I will say at the bottom, they have OCD. Now, I want you to know that they took OCD and PTSD out from under the heading of anxiety disorders in the DSM-5, and they gave them their own category. So when I'm talking about the screening tool, we're not looking at OCD and we're not looking at PTSD. We're not looking at those symptoms. They kind of were given their own category and they have their own kind of treatment, specific treatment. So question to you guys, what is the most common anxiety disorder in children under 12? Anyone want to guess?
Separation anxiety.
Yeah, you got it, Sienna. Good job. It's separation anxiety. So always keep that in mind. And then into the teen years, into ages 12, you're looking at more generalized anxiety and social anxiety. Right? So what are the current recommendations for screening? So the United States Preventative Services Task Force just released the current recommendations last month in October. They released new recommendations that they recommend screening for children and teens ages 8 to 18. They do not recommend screening ages 7 and under because the screens are not reliable and the kids are not reliable with their reporting. So they only recommend screening ages 8 to 18. So if you have a younger kid, you can't use a screening tool on them. It becomes a little bit trickier. So that's like I said, it just becomes a little bit trickier. So when we're talking about this screening tool, we're talking about using this in ages 8 to 18. So there are different screening tools. There are some screening tools that assess for specific diagnoses, like the social phobia and anxiety inventory for children. The GAD-7 is looking specifically at generalized anxiety disorder. They have the Y-box, which is the Young Brown OCD scale, which is looking specifically at OCD symptoms.
looks like, Dr. Olivier.
But there
Is
are
that-
some, there are a couple that.
Okay, you're back now.
Okay, yeah, I just got to notice the internet's unstable. Okay. So we're gonna, the scared is the most research, it's the most evidence-based, it's sort of the gold standard for this age group. So that's the one we're gonna focus on. It's an evidence-based screen out of the University of Pittsburgh. There is a child report and a parent report. So the child has to be able to read. If they're not very good at reading, you as a clinician can go through the questions with them individually. It is looking for generalized anxiety, separation anxiety, panic disorder, social phobia, and it has screeners for school phobia too, which also it can be called school avoidance. It has 41 items and 5 factors that parallel the DSM-4 classification of anxiety disorders, but the DSM-5 didn't, for those specific anxiety disorders, it didn't change criteria too much. There is mild child-parent agreement, good internal consistency, retest reliability. So it's an evidence-based screen, basically. It is sensitive to treatment response. So you can use it as you give it to them, send them for treatment. When they come back 6 months later, you can give it to them again and kind of see if treatment's working or not. And it takes about 10 minutes to administer. So it doesn't take too long to give the screen. And so this is what it looks like. This is the child version. It's very, very similar to the parent version. And they're rating their symptoms on a 0, where they hardly ever, not true, 1, somewhat true or sometimes true, or number 2, very true or often true. So say you're a kid with separation anxiety filling this out. So you start with number 1. When I feel frightened, it's hard for me to breathe. What disorder you think they're getting at there?
Panic?
Yeah, correct. So if so number 1, you're looking at panic disorder. So for number 2, I get headaches when I'm at school. That one's looking at school phobia. Number 3, I don't like to be with people I don't know well. That's looking at social anxiety. Number 4, I get scared if I sleep away from home. Kid with separation anxiety. Whoop. Number 2, they would check off 1 or 2. So you can see they rotate kind of the criteria for each of the disorders, each of the anxiety disorders. So number 5, I worry about other people liking me. That goes along with generalized anxiety. When I get frightened, I feel like passing out. Panic disorder again. I am nervous. Generalized anxiety disorder. I follow my mother or father wherever they go. Separation anxiety. So you can kind of see they mix up, they take the criteria for each of the anxiety disorders and they mix them up. And they kind of give you a range on what you can report. I have nightmares about something bad happening to me. And that's along the lines of generalized anxiety. To the next page. And it goes on to 41 questions. They ask about, down to number 41, I am shy. That's getting at social phobia. I feel nervous when I'm going to parties, dances, or any place where there will be people that I don't know well. That's getting along the lines of, that's social phobia too. And then keep going. And then the parent, this is the parent version. So you have the parents fill it out as well. And again, it's the same thing. When my child feels frightened, it's hard for him or her to breathe. That's getting panic disorder. My child gets headaches when he or she is at school. My child doesn't like to be with people he or she doesn't know well. It's the same exact questions, just the parent answering them about their kid. And then one more. So this is the scoring. Scared. I used to love scoring this. I was like, this is like my little OCD brain loved scoring the scared when I was a resident. It's a little bit tricky, but you're going to go through each one of these. And so for number 1, it highlights the box you put, and you're going to put a 0 or 1 or a 2, depending on what the child put. And then number 2, you're going to, in the white box, you put their score. And then at the bottom, you add up their scores, and it's sort of breaking them down for you. It tells you, the first column there is panic disorder. And so if the cutoff is 7, so if they score a 7 or higher, you're looking at this kid might have panic disorder. For generalized anxiety disorder, there's more symptoms, there's more criteria. So the cutoff is 9. all the way over to separation anxiety. The cutoff is 5. So you can kind of see if they reach that threshold or higher, they most likely have this disorder. In general, if you look at the total score as well, and if the score is equal to or greater than 25, they most likely have an anxiety disorder. And you can kind of quantitate the severity of it based on their scoring too. Okay, any questions about the SCARED?
Is it free?
Yes, it's free. Yes, it's published online. Absolutely.
I'm gonna put it in the chat so you guys have it.
Awesome. University of Pittsburgh as well has an online scoring system, like where you can click on their link online and just input the scores and it scores it for you. I couldn't get the link to work on my iPad though, so you might have to do it from a desktop computer. But
We can send that out at the end too.
Yeah. Any other questions about the SCARED?
I did really quick. It's not specific to the SCARED, but when you have these dual symptoms, if I could say it that way, the difference between it being diagnosable or developmental is the duration of the symptoms. Is that right?
It's the duration of the symptoms. So anxiety disorders tend to be persistent. You know, they tend to not go away. The settings, but that's, settings, it could be a specific phobia, and that is an anxiety disorder. So that's not as sensitive. And then the functional impairment, the level of impairment, like, are they not sleeping because of this anxiety and this worry? Are they getting stomach aches all the time? Or they're calling their parent all the time to leave school? Are their grades dropping in school because of worrying and anxiety? Are they getting suspended in school? Are they getting more write-ups, more detentions? Like, are they behaviorally acting out? So all that shows the level of impairment that goes along with it. So it's the level of impairment makes it a disorder versus normal development. Okay, so briefly going over treatments for anxiety disorders. I'm going to roll through these pretty quickly. Gold standard is cognitive behavioral therapy, and that is for mild or moderate anxiety disorders. I always recommend starting with therapy because that therapist is also going to know if it's severe enough or if it's not getting better with therapy and can make that referral for medication management. We oftentimes do the reverse. We often start with medication, but in my opinion, you should always start with therapy if it's an anxiety disorder. It can be school-based, group-based. Basically, any therapy is better than no therapy. And next slide. There is medications that can help. There's actually only one FDA-approved medication for treatment of generalized anxiety disorder, and that's duloxetine. It's the only medication company that put in the money to do the studies in kids and youth to get that FDA-approved label, but still the gold standard are SSRIs. We still use SSRIs, even though they aren't specifically have that FDA indication. They are FDA approved for OCD and depression. We still use SSRIs first line. So just know that. And then just briefly, some practical interventions that, say, if you're in a primary care setting and a parent is asking, what can I do to help my kid with this anxiety? Number one, a routine, regular schedule. Because if a kid knows what to expect day to day and knows what time they're going to bed, knows what time they're getting up, knows what time they're going to eat, that is anxiety alleviating right there in itself. Number two, so you got your parent doing the routine and the schedule. Number two, a food and diet plan, just making sure they're moving at least 3 times a week, 30 minutes each time, up to 150 minutes a week. Make sure they're cutting down on sugars, any artificial colors in their food, eating more whole foods. And then you can encourage a reward system with like a star chart, adding, for any good behaviors, they're getting points or putting marbles in a jar to get a bigger reward. I put parent-child interactions on here because if we were doing a behavior-based program like parent-child interactional therapy, the first thing you work on is improving positive interactions between the parent and the child. So making sure the parent and the child are having positive interactions is very important. Like, are y'all sitting together for like 5 minutes each day, just talking about the day? And then you can coach the parents in dosed exposures. Like if it's a kid that's sleeping in their parents' bed, trying to sleep in their own bed, there's a gradual process to getting them out of their bed. But like I said, there could be a whole lecture on treatment. So just some brief things to think about. All right, any questions? We're a little bit over time. All right, well, I'll punt this to Jody. Thank you all for your attention.
Yes, thank you, Dr. Olivier, for that. We will send out the slides and the PDF of the SCARED, as well as the link to that, if we can find it, the University of Pennsylvania scoring for the SCARED. So what we're going to do now is just let you know the next our next topic will be medication management for ADHD on the 13th of December. You'll receive a reminder and link to that, but we're also going to put in the chat, if we haven't already, the link to get CEU credit. You have to fill that out. It's only live for 48 hours. I'll also email it to you if you go ahead and fill it out to get your credits for CEUs. So any additional questions that you think of that are come up, you can email me at ppcl@la.gov, or we can get it to Dr. Olivier. But just thank you so much for your time and your attention. Brandy, thank you for presenting your case. It was an excellent case, well prepared and thorough. And Dr. Olivier, thank you so much for the slides. We look forward to seeing everyone in December. Thank you.
Bye, everybody.